Good morning, everyone, and welcome to the historic Anacostia and the great Ward 8. I'm Robin McKinney, a long-term Ward 8 resident of the District of Columbia, Washingtonian, and I happen to be the Advisory Neighborhood Commissioner right here at 8A06. I met Muriel Bowser when she was a council member, and she asked me to take a leap of faith and trust her leadership. I did, and I can proudly say my mayor have invested not in just Ward 8, but all 8 wards. When she took office, she made sure that DC residents who far too long had been locked out of prosperity that our city has to offer for so many. Now we have a seat at the table. She committed to building economic development, infrastructure, opportunities that will foster homes and businesses in our community. She committed to ensuring that downtown Anacostia, the hills of Anacostia, the avenue of Anacostia, would turn into a place where we can eat, shop, and dine. This corridor has been transformed to, just to name a few, Turning Natural, Checked Enterprise of Ronald Moulton, the amazing Anacostia Center, now co-owned by Wyckoff, Nubian Human, Mahogany Books, Andy Schlout, Busboys and Poet, Children's National Center right here in Anacostia. Let's not forget Anacostia Playhouse, Dion Reader, Far Southeast Collaborative Office Building. And finally, a healthcare system that will ensure that all our residents have access to full-service hospitals, bringing maternity care back to Ward 8. And of course, this brings us to this moment. I remember the Big K liquor store. I think we all do, right? Where Starbucks currently is right now. And numbers of DC mayors that tried to do something with this property. But as with everything, it takes a woman to get the job done. Mayor Bowser, in partnership with the Honorable Council Member of Ward 8, Trayon White, worked to support the development of Maple View Flats, 114 affordable housing units behind us, the first Starbucks in our community, and now Cedar Hill Urgent Care Center right here in historic Anacostia. This urgent care will offer excellent urgent health care services to DC residents all over the District of Columbia. Housing, jobs, art and culture, and business and ownership. Thank you for all you do, Mayor Bowser. I am honored today to introduce a woman who needs no introduction to our community. I always say my mayor, but your mayor, the current mayor, another 3 terms, the next mayor of the District of Columbia, Mayor Bowser.
Thank you. Well, let's give it up for Robin McKinney. Thank you, Commissioner, for those kind words, and thank you for it. You know, it did me proud to hear about the work that we have done through your eyes and through your lens and in your voice, speaking for the residents of your single-member district. I am proud that we have kept our promises, and I want to thank you for taking that leap of faith. I want to thank Ward 8 residents for continuing to believe and trust and challenge us to deliver for you. I want to thank the council members who are here. Your council member for Ward 8, Trayon White. Give him a big round of applause. And former mayor and council member for Ward 7, Vincent Gray. Give him a round of applause. So I'm just really delighted to be here today in historic Anacostia to talk about how we have invested and worked long and hard for high quality health care for all Washingtonians east of the river. And I want to acknowledge our Deputy Mayor and his team, Deputy Mayor Wayne Turnage. Give him a big round of applause. Wayne and his team have been very focused. You know, I like to tell this story. Wayne likes it a lot. But 8 years ago when I was sworn in, I mentioned something in my speech that I hadn't really vetted with everybody yet. And what I said was we would build a new hospital east of the river. And after my speech, Wayne said, "Oh, I heard you say that. I don't know how we could do that." I said, "You got this, Wayne." And because he has stuck to it, in my administration and in Mayor Gray's administration before that, we have been able to make a very, very complex set of promises come to fruition. I want to thank all the community members who did not take their foot off the gas. Let's hear it for Ward 8. And just so very pleased about the progress we're making. I want to thank the Universal Health Services, Vice President Kimberly Russo, President Mark Miller, Dr. Bass from George Washington University, and their entire team and leadership and partners. I want to acknowledge that you have invested or will, over the course of the next years, $75 million in our healthcare infrastructure east of the river, including this new urgent care center. I also want to acknowledge that even before we deliver the new hospital, it's gotten bigger. So just a couple of weeks ago, we announced that we would be adding a 4th floor to the hospital, and that expansion will allow an additional 48 beds, and it is made possible by an additional $17 million investment from Universal Health Services. So I think that is fantastic. We also promised, and this has been a promise of the council probably before I joined, Mayor, you may remember better, but we said that we, the district, wanted to be out of the hospital business. We wanted a quality hospital provider, and we wanted an academic partner. And Dr. Bass, as I mentioned, representing the physicians of the GW Health Plan, represent that for us. So once again, thank you so much. So with today's ribbon cutting, we move a step closer to fulfilling a vision. You've heard us say before that improving healthcare is not just about building a hospital, but about building a system of healthcare in a healthy community. So part of that is opening an urgent care center so that residents are getting the right care in the right place at the right time. So it doesn't mean that you have to call 911 or go in an ambulance or sit in an emergency room. It might mean that you're going to your primary care physician right down the street, or it may mean, if you're off hours, that you're coming to a place like this, an urgent care facility. What it also means is that we're working hard, very hard, every single day to deliver on having healthcare closer to you. So this urgent care center, we will open on Monday in Ward 8, and we continue to look for locations, and we will, for our second center related to the Cedar Hill Regional Medical Center in Ward 7. This urgent care center is what the community asked for. As Robin mentioned, you will come here for prenatal care right in Ward 8, close to home. Patients can get x-rays and blood work. And this is also the place to go if you're not feeling well from asthma or colds or infections or unexpected health issues. The site will be open 7 days a week from 8 a.m. to 8 p.m. and we expect that it will serve up to 9,000 people a year. My understanding is also that the staff members, 7 staff members have already been hired, 5 of which live right here in Ward 8. So again, I want to thank all of our partners. I want to thank our community for sticking with us throughout the transformation. I see Dr. Lewis and Dr. Basron here, also members of my cabinet, and I'm so grateful for all that they do. We were just together, Mayor, for the opening of Lidl at Skyland. Just this past week, we talked also about how we as a community will reach a pretty big goal of 20,000 new Black homeowners in Washington, D.C. by 2030, and a lot of them going to be right here in Ward 8. And today we open this urgent care center. So we will continue to build healthy and strong communities in all 8 wards. And we know what we have to do to continue to grow in Ward 8. So with that, I want to turn to our council members to also talk about our progress. And I want to start with our host council member, and then we'll hear from Mayor Gray, who also chairs the council's Committee on Health. So with that, Council Member Trayon White.
Good afternoon. First, I want to thank you, Mayor Muriel Bowser, for your leadership, my council colleagues, more specifically, Councilman Vincent Gray. Remember when we ran around the same time when you came back, I know you were adamant about ensuring that we had a health care system east of the Anacostia River. The east end, as you say. Yeah, there we go. I want to thank the Universal Health Services, Cedar Hill Urgent Care Team, GW Health Family, and community members and residents east of the Anacostia River. We live in a city where the divide between the have and the have-nots has been increasingly getting wider, and this is an effort on behalf of the government to close that gap. There are a lot of residents living in Ward 7 and 8 that feel undervalued, and so it's our responsibility to make sure they know that we care. Our residents have long awaited for the same access to amenities as the rest of the city, and today is the day. This facility will be the urgent care facility in Ward 8 and the first of 2 locations east of Anacostia River. Access to health care is a fundamental human right. Our goal is to build affordable, accessible, and available healthcare system for residents throughout our city. This facility will be updated with plans, as you mentioned, Mayor Bowser, to grow the facility here at St. Elizabeth East Campus. Give a round of applause for that. That's amazing. And thank you to our University Healthcare Services system. The Urgent Care Center will meet immediate needs to focus on some of those things that our residents don't need to go to the hospital for. We know in our council hearings that a lot of residents didn't go interact with medical facilities until they went to the hospital. And that was causing a big imbalance in our healthcare system. And it was leading to more infant mortality deaths. And so it's on us as leaders to create the vision that our residents can follow. When we think about healthcare in our city, we can see the value gap where some areas of people feel more valued than others. It is this reason that we stand here today in this facility to close that gap. We must ensure that all residents have access to equitable medical treatment. In moments like this, we realize the doors are opening to a future that is getting brighter and brighter for those who have left out of the equation. I see we also are joined by some of our advisory neighborhood commissioners. If you're an advisory neighborhood commissioner here in Ward 8, raise your hand for me, please. Raise your hand, Robin. You right there? There we go. And so it's been people like Marion Berry who have stood in the gap and fought for those underprivileged residents here in D.C. for many years. And so we stand on great shoulders. So I'm honored to join you all today as the council member here today, but know that sometimes in life there are those who plow and those who reap, and we are reaping for those who came before us. And so I want to thank you, Mayor Muriel Bowser, the council staff, my staff, all the people that work on the back end that don't have the titles and the name recognition to help us help our city grow and be a more equitable city. My name is Trayon White, and I approve this message. Thank you.
And now we're getting there, Mayor. We're getting there. And so I want to introduce you to talk about our urgent care center. Councilmember Vincent Gray.
For those who are wondering, I tore my Achilles, and it's been a challenge. I'm walking around with this boot on, and will do the best I can with the time that I have. So thank you, Mayor. I appreciate it very much. And we were together recently just to open a new Lidl grocery store here in our midst, and I'm so excited about the opportunity that we have available to us. And frankly, this is truly an exciting day here in cutting the ribbon on the Universal Health Services GW Health Urgent Care Center that we are making available to us now. What a great opportunity this is to be able to create yet another another opportunity for people to be served for health care here in the District of Columbia, and especially on the East End in Ward 8 of the District of Columbia. The reality is, at least in my opinion anyway, Kim, that we're creating a true healthcare system on the district's East End for the first time ever. MBI already created an urgent care center in Ward 7, and a second one will open at the end of 2023. We hope by the end of 2023, maybe a little later than that, but it'll be soon. I'm really excited to be able to also talk about our 184-bed, isn't that wonderful, 184-bed GW Health Cedar Health Center. We see right here the notification of that, and an adjacent ambulatory care center that will open in early 2025 on the St. Elizabeth's campus. Isn't that wonderful news? Yeah. I want to thank you, Mayor. I want to thank Deputy Mayor Wayne Turnage, a wonderful man who I've had the pleasure of working with since he came to the District of Columbia from Virginia. How about a big hand for Wayne? Wayne is a great guy. I also want to thank the former city administrator, Rashad Young. I want to thank Ben Stutz, who's working with Kim Russo and my colleagues as well, and our staff to be able to get done the things that we're trying to get done at this point. This is absolutely an auspicious day that we want to be able to mark. This is a day that we've been working hard to make happen, and I am so happy that we're being able to say, Wayne and my colleague, I want to say again, thank you so much for the work that's being done. And I want to thank you, Trayon, for all the work that you're doing also as a council member for Ward 8. I want to thank you for being a good colleague and a good friend also. So let's all recognize that when we cut the ribbon tonight, that opening the door of opportunity for so many people who just haven't had the chance to be able to have these services available. We've had the United Medical Center and other services available, but we know that we can do better than that. And can't we do better than that? Yeah. Thank you. Thank you so much, everybody. I appreciate it very much.
And next, I want to introduce our partners in this work in the urgent care and also our new hospital. First, Kimberly Russo, who I have mentioned, who is with Universal Health Services, who will operate this facility and our new hospital. Kimberly.
Good afternoon, everyone. It's a real pleasure to be here today, and thank you for coming. I'm really thrilled to be here today to open and celebrate the new Cedar Hill Urgent Care GW Health. This is a vital addition to health services east of the Anacostia River. As many of you know and you have heard today, over the past several years, we have proudly partnered with the government of the District of Columbia to create a true comprehensive healthcare system to better meet the needs of our region and the communities of Ward 7 and 8. Opening Cedar Hill Urgent Care here in historic Ward 8 is the first step in creating this robust academic medical network, which will enhance access, equity, and the outcomes in our nation's capital. I'm happy to announce that the Cedar Hill Urgent Care GW Health will open its doors to patients this Monday, October 10th at 8 a.m. This facility would not be possible without our partnership with GW University, the GW School of Medicine and Health Sciences, Dr. Dean Bass, GW Medical Faculty Associates, and our physician partners who are providing the care. The urgent care will be here 7 days a week to serve this community from 8 a.m. to 8 p.m. This will allow us to serve the district residents for a long time coming. The Cedar Hill Urgent Care will provide comprehensive services for a wide range of everyday illnesses, such as colds, flus, ear infections, sprains, minor COVID, thank you, Councilmember Gray, and cuts and burns. The urgent care will also provide basic lab and x-ray services to the community. The Cedar Hill Urgent Care GW Health will be, in the future, fully integrated with the new Cedar Hill Regional Medical Center, which, as you heard, is opening in early 2025 on the St. Elizabeth's campus. We will also be proud to open a second urgent care facility, hopefully sooner than late 2023, early 24, in Ward 7 to help establish this robust, coordinated system of care for all of district residents. The development of this comprehensive network of care will allow individuals, as you heard the mayor say, get the right care at the right time in the right location. These new health assets and investments, combined with the existing network of high-quality providers and clinics, will change the trajectory of the health outcomes for residents in Wards 7 and 8. We look forward to collaborating on all of these efforts to better serve our city. I would like to express my sincere thanks to the mayor, to Deputy Mayor Wayne Turnage, to council members Vince Gray and Trayon White, to the support of ANC 8A, and to many city officials, as well as my team who made this vision a reality. We also know that there are many partners within the district government, as well as GW, that I would like to thank for their commitment and partnership in really getting behind this vital effort. Thank you all for joining us as we celebrate this important effort and forward movement in the advancement of healthcare in our nation's capital. I would now like to introduce, or Mayor, are you coming up to introduce Dr. Bass? And thank you all for this day, and I cannot wait to see the success of this urgent care. Thank you.
Wow, this is fabulous, you know? I had no idea this was going to be such a wonderful gathering. It's really exciting. So thank you, Mayor Bowser, for the opportunity to be here, and of course to our distinguished guests in front of me. My name is Barbara Bass. I have several hats at George Washington University, but I am, in this capacity, the Dean of the School of Medicine and Health Sciences, as well as the CEO of the Medical Faculty Associates. That's the group that is so excited to be here, to be part of launching this incredible new medical enterprise integrated to our systems, currently over there on the west side of the city, to enhance the level of care we can say. I have in the back of the room here several people that are part of our enterprise, including a couple of our chairs of the departments, Dr. Rob Shesher, who chairs our Department of Emergency Medicine, Dr. Bill Borden of Medicine, and I also want to call out the two physicians, Dr. Lee and Dr. Davis, who are going to be here on Monday and who have all the way led the development of this fabulous system. So I hope you'll have a chance to engage with them. But I got to say that for us, the really exciting thing is that we finally are, we, the GW School of Medicine faculty, as and physicians, are going to be part of the people that will serve the healthcare needs of the citizens of Anacostia in this first little, but you see it, beautiful facility. We're so excited to see that this is the first step in developing these plans for Ward 7 and Ward 8. And I got to tell you, it's, in my relatively short time at GW, this is the one project that throughout the dark days of COVID has kind of served as a moment of hope and aspirational activity for our faculty, for our students, and for our residents. People are excited about this. So I want to thank, on behalf of the school, the wonderful leadership in this community that has made this happen. Of course, Mayor Bowser, of course, Ward Councilor 8-member Representative Trayon White, who also is at GW, and of course GW alumnus Vince Gray, and former mayor, of course, who have really tirelessly, long before I came back to this city, fought to have this type of excellent health care available to the citizens of this city. In close collaboration, I also want to thank my partner, Kim Russo, in this, because this is truly a partnership. Healthcare is a real team sport, if you haven't ever noticed it. Yes, it's serving the community, so the community is a really important partnership. Our patients' engagement is vital, but from the delivery perspective, you got to have a great hospital partner, you got to have great docs, you got to have great nurses, you got to have great staff, and I think in this great institution, as we launch this next door, we have that chance. I will say that the physicians who work currently at GW, our GW MFA and our School of Medicine and Health Sciences, are really proud of the many, many years of healthcare, high quality healthcare delivery we've provided to the citizens of Ward 7 and Ward 8. But we all know that's been often a long and difficult trek across town to get there. It's been a concern for us all along as well. We're delighted to have some of our faculty serve at UMC currently, but all are looking forward to a way to do this better. So we are looking forward to that day when a trip across the river is not necessary for the vast majority of the health care that the citizens of this area will need. And we're going to provide that terrific, convenient, accessible, equitable health care that we really do see in our future addressing the desperate, I'm going to say, health disparities in this city at this time. I want to remind everybody that actually the School of Medicine and Health Sciences at George Washington University is the 13th oldest medical school in the country. And we are proud of that heritage in this city. We've been in Washington, D.C. that whole time. And we are proud of the fact that we have scanned the horizon for opportunities to better engage with our community on multiple fronts. And healthcare is just one of those. But we are really, in the medical community, delighted with that. So I look forward to this next chapter and our opportunity to serve all the citizens of this great city. And I'm just thrilled to be here at this moment when I just happen to be able to partner and help nudge this program forward in the most exceptional way to serve our city. So thank you so much.
Well, I want to thank all of our speakers, and I also want to acknowledge a few more members of our team. Dr. Holman, who is here, he is our medical director for DC Fire and EMS. Linda Harley Harper, our director of gun violence prevention. Kevin Donahue, the city administrator for the District of Columbia as well. So with that, we are going to get ready to cut the ribbon. I think we're setting up this way. We're going to set up this way. And while we do that, I'm going to take a few press questions. Thank you, everybody. On the count of 3.